Joining us now, Julian Walker. And Julian is with the Virginia Health and Hospital Association, and he is a vice president there of communications. Julian, great to have you, man.
Good morning, sir. And actually, we've got a twofer for you this morning. It's
a twofer.
Myself and my colleague, Julie Dime, who you know, who is our vice president of government advocacy. So you get the Laurel and Hardy, the Penn and Teller of VHHA, although she's the funny one. I'm the straight man.
Well, it's always good to have the straight man on you also, and it's great to have you on, Julie. I know we've been talking about getting you on, and we never just got around to it, and I'm sorry for that. My bad, Julie. So we got Julie and Julian here from VHHA, and a big shout-out to their president and CEO, Sean Connaughton. Great guys, doing a fabulous job. I always love having Sean on my show. He's so much fun, and he gets so much. Half the time he's on, we have on a segment, Julie, so you know 50% of it is whatever the topic is of the day. The other 50% is a walk down memory lane because he ran for lieutenant governor. He knows everybody, and he knows where all the bodies are buried, so it's always fun. It's always fun to have him on. Okay, we've got a special session. Maybe we'll talk about health issues. I don't know. But what's on your agenda, guys?
Well, thanks again for having us. We just wanted to, it's sort of the end of the month or the beginning of the month, and we just really had a great month here in the Commonwealth, both on the hospital front and just for the Commonwealth as a whole. We did an event in May where we talked about all of the work that our members are doing on the behavioral health front. As you know, there's a lot of talk going on about the challenges with making sure that people who need mental health and substance use treatment get it in a timely fashion and get it in the right place. So we did an event on that. Our members are adding, in the next couple of years, 200 new behavioral health beds. We just had a national ranking organization list Virginia hospitals number 2 in the nation overall for patient safety and healthcare quality. U.S. News and World Report just listed Virginia 7th overall in the nation, and a lot of that was because of healthcare. And so just a lot of stuff going on. We just appreciate the chance to get a second to talk about it because we're really, really excited about the developments that are happening. And the hospital community is really a big part of that, not the only part of it, but a big partner in that. And so we're really excited about some of the stuff that's come down the pike in the last month.
Yeah, Julie. Good morning, John. It's Julie. I'm so proud to be here. I have been wanting to be on the air with you for a long time now. A lot of my friends join you, so it's really great to have you or to be on. I've always been told that I have a face for radio, so this is great to be here. And as Julian just said, it has been a banner month for us here at the association. I lead our advocacy efforts. So we do actually work outside of session, not just during the legislative session. We are busy with all kinds of things, as Julian noted, with our press conference that we had with our members on the TDO issues, on behavioral health issues, which was very successful. We're doing a lot in that space. As Julian said, this is certainly a priority for us and for our members to take care of those in our community that are struggling on behavioral health issues. So Julian mentioned we've made great strides in becoming number 2 in quality and certainly number 7 overall. So we're very excited about those numbers. We know how great our hospital systems are and our hospitals are, but it's great to be recognized both nationally and on the statewide level.
Julian, walk our audience through this. You guys mentioned the progress you're making on mental illness and behavioral health. Of course, whenever you bring that up, it harkens back to the tragedy with Senator Craig Deeds, his son that needed help. He didn't get it, and ended up committing suicide after striking his father and almost maiming him. He still has the scars and all that from that. And part of that discussion was the center was trying to get him a bed and check him in somewhere. And in Bath County there was no availability anywhere. Walk us through from that point to today, what has changed? Can you do that?
Sure. So I'm going to let Julie jump in here in a second, but as you pointed out, there's been a lot of focus on mental health reform, both in regards to the tragedy involving Senator Deeds, but also prior to that, the tragedy at Virginia Tech. And so a lot of work has been done on the policy front. And like I said, I'm going to let Julie jump in here for a second because this is her bailiwick. But legislation that was passed subsequent to the tragedy involving Senator Deeds created what's sort of known as bed of last resort legislation. And so that means that if a bed cannot be found at a hospital, then ultimately the state hospital has to take someone who's being detained under a temporary emergency detention order because they pose a potential threat to themselves or others. And so one of the challenges has been that there's just a growing demand overall, both for voluntary behavioral health services for people who are coming to the hospital themselves and saying, I need care, and people who are being admitted on an involuntary basis. And so our members, as we said, are adding hundreds of new beds to address that. In fact, and I'll let Julie jump in here, our members have handled in the past year more than 50,000 psychiatric admissions.
Yeah, that's right, Julian, and as he said, we are seeing a lot more voluntary inpatient commitments that are happening, and I think what that did, you mentioned, the tragic experience with Senator Deeds, Virginia Tech. Prior to those events, there was certainly a stigma on seeking help on the behavioral health side, and I think that over time what has changed is that stigma has lessened. Obviously, I think it's still there, but we are seeing a reduction in the stigma for wanting and getting help on the behavioral health side. So we have so many committed and dedicated behavioral health providers, not only in our hospitals, but outside our hospital setting, that are doing just excellent work and trying to make sure that stigma goes away, and that people are able to access the help that they need. Most recently, there was some legislation that passed that was day of to be able to get services the day of that someone was in a crisis, and all the time, sometimes we didn't have access to services when they were in that crisis mode, and now we're hopeful that is changing. So we're all responding to those needs, and it's not just the hospitals, but also our law enforcement, and that's a big area that we're hoping to see an improvement on. Law enforcement is having to deal with issues that are in that behavioral health sector, and in partnering with law enforcement and our hospitals and our behavioral health providers, we are making great strides in knowing how to treat folks who are in a crisis and getting them the help that they need immediately.
And that's a great point, and I'll just piggyback on that very quickly. Last fall, Julie's team, working with other partners in the provider community, also developed, after a 2-year process, these new screening and assessment guidelines so that people who are admitted for behavioral health care, these guidelines sort of set up a protocol, a baseline, so that people who need care can be routed to the appropriate place. So if you need substance use or detox care, you get that. If you need psychiatric care, you get that, whether it's on a voluntary or involuntary basis. So those are just some of the examples, including some of the legislation Julie mentioned, of the work that we're doing, our members are doing in the behavioral health space.
You're on the John Fredericks Radio Network, Trucking the Truth Across America. I'm with Julian Walker and Julie Dime. They are with the Virginia Hospital and Healthcare Association, acronym VHHA. Julian is Vice President of Communications, and Julie Dime is Vice President of Government Advocacy. Let's get the Medicaid expansion report saying that the number of people taking advantage of Medicaid expansion has not met expectations. Why?
Well, I think a couple things. The number, in fact, is only slightly behind the projection. So actually, overall, the numbers are generally positive, but tracking a little bit behind projections. The other piece of this, though, is sort of the revenue piece of this. As you know, John, the hospitals are the only healthcare entity in the Commonwealth that are contributing significantly to the tune of hundreds of millions of dollars a year to cover the state's cost of Medicaid expansion. No one else in the healthcare space, whether it's the insurance sector, the drug companies, other kinds of providers, are contributing, even though they also are benefiting from coverage expansion. And so one of the next questions we have, in addition to continuing to work on enrollment efforts in support of the state, is that funding piece, because hospitals right now are the ones that are the primary driver of providing that funding. And so we need to continue to have conversations about whether or not it's appropriate for other people in the healthcare space who are benefiting from this to start contributing as hospitals have.
Yeah, and the only thing I will just add to that, John, we continually said that passing Medicaid expansion and providing up to potentially 400,000 individuals access to care is actually a cost savings to the state. And we're seeing that, and I'll just briefly jump back to our behavioral health conversation we were having, and that more money is now being able to be spent on behavioral health because of Medicaid expansion. And those folks who are accessing the help, we are seeing a large number of those are for behavioral health reasons. So jumping back just a little bit to our last segment in promoting of Medicaid expansion, we are seeing what we thought all along would happen, and that people are being able to be helped and improve their life and be able to get back to work and enjoying their family and being productive in their life again.
Well, much to the chagrin of many of my conservative listeners and friends, the purpose of Medicaid expansion was to provide health care access for lower income working people that were falling through the cracks of health care. They made too much money to afford Obamacare subsidies or traditional Medicaid or Medicare, but they didn't make enough money to buy their own health insurance with costs out of control. And so the purpose of that was to provide them the opportunity to get care while they move up the economic ladder, benefit from the Trump economy, and move off it. So when you look at the numbers, okay, and you say, well, it's not up to expectations. It's not up to expectations of what? Well, it's not up to what we thought it would be, 400,000. No, it isn't. It is because the Trump economy is pulling people out of the poverty level, and they have enough money to buy their own insurance now. So therefore, they don't need it, which was the whole purpose of it. If you didn't look at it upside down and you take the conservative reforms that Kirk Cox and the Republicans put in, this is why this argument drives me bat crap crazy, because they put the conservative reforms in so that it would provide people the incentive to get off of it as they get better jobs and make more money and get companies that can either provide it or they buy their own insurance in the private market. That was the purpose of Medicaid expansion. It was not to expand a government
program. John, to a point you've made earlier when you were making the case for this, as you said, a lot of the people that would benefit from this are Trump voters. And obviously you as the Trump Virginia campaign chairman, you had that perspective, but there was just recent reporting indicating exactly that the majority of people who have enrolled in this coverage are people in communities in Virginia that overwhelmingly voted for President Trump in 2016.
That's right.
And they're gonna come back and they're gonna vote for him again in 2020, and they don't want to be on this, guys. I mean, this is the whole thing. Our Trump voters in Southwest Virginia and other areas working 3 jobs, they don't want this. They don't want to be on this. They want to get a better job. They want to get a better opportunity. They want to move off it so they can do a better job in supporting themselves and their families and buy their own. That's what they're trying to do. That's why they voted for Trump in the first place. And so the numbers are down because the Trump economy is booming. That's why it's down. So it's a good thing, not a bad thing.
Right.
Julian?
And John, I'm just going to add to that real briefly here. You're exactly right. We have a lot of jobs out there. We don't have the people that are in the place to take those jobs. For example, especially out in Southwest, we have a lot of folks that are unfortunately addicted to opioids and cannot pass a drug test. So there are jobs available. We just got to get those folks help and get the help that they need to overcome that addiction, to be able to get back to work and improve our economy.
You know, it's great when a plan comes together, and that was why I changed my position on Medicaid expansion, just for all the things that you're saying. And in a expanding, booming economy like we have now, all that is a stopgap measure while people are trying to get from point A to point B. And as they do that, they need the care, as you say, to get off of some of their addictive habits in order to be able to get the jobs that are available for them today. So look, I thank you guys for coming on. For those of my friends that go nuts over Medicaid expansion, you really don't get it. I'm sorry. I love you. You don't get it. And it has nothing to do with expanding Obamacare. Like, stop saying that because it's dumb. It's for our voters. You give them an opportunity to get from point A to point B, and that's what it's doing. And the numbers are down because the Trump economy is booming. So it's all good. John Fredericks Radio Network, I want to thank Julian Walker and Julie Dime for being with us. Thank you.